So you say you want to be a doctor. Or for the parents, you say your child wants to be a doctor. MCAT. Before we get to that, let's set this up. Let's talk about fear. That's right, fear. Let's take it a step back. Earlier, we said there were 27 different human emotions that we all have. But there's one emotion in particular that we must learn to conquer, control, and confront. And that is fear. Follow me. Because as we approach the MCAT, if you self-reflect, if you introspect, many of us are going to have a little fear for a few different reasons. Number one, think about it. We've been on this journey. Just even this video series. We started this journey before high school. That means at any age. Then we were on the journey for high school. Then we were on a journey for choosing colleges, and then finally entering colleges. And now we're about to talk about the MCAT. And so keep in mind, the whole purpose, or part of the purpose for college, is good grades. And good grades prepares you for the MCATs, because the MCAT score is king as it relates to getting into medical school. So fear is going to play a role in that. But hold on. Don't let anyone fool you. Every single person has fear or has had fear. But the greatest, remember we talked about greatness? They've learned to conquer, control, and confront their life fear. Real quick, remember a few videos ago I talked about being a stutterer and face my fears and deal with the fears? Well, did you hear what I said subtly? You couldn't tell that I was not a stutterer until I was 31 years old and chief resident. While in medical school, we had this situation, it was many, many years ago, where somehow I wound up being the only provider in this patient area. And the patient started to have some breathing difficulties. And I had some fear surrounding, what do I do? Am I going to be able to speak? I had to confront. It was real fear. But I had to confront and control this fear. Fortunately, I was able to get it out. We were able to go get the chief resident, charge nurse, call the code blue. The patient ended up fine. But the point is, fear is always around the corner. Don't let anyone fool you. It's okay to have fear. Confront it. Acknowledge it. Don't stand there. Move past fear. Now, notice I said that fear is okay, because fear can motivate you. If you think about it, if you're out in the park walking and you see a bear, don't let anybody fool you. The bear's running towards you, they've got some fear. Don't let anybody fool you. And if you don't start running, I would say that you may be a fool. So that's fear. So fear can help you. Fear can protect you. It can motivate you. You run from the bear. It's okay to have fear, but you must move past it. But what you don't want to ever have is self-doubt. Again, it's self-doubt. Another reason why the MCAT is going to get really scary for you is because if you choose to take it, if you choose not to do a gap year and you take it the spring of your junior year, hey, it's going to be a difficult road in that spring because you're taking class, you are preparing for the MCATs, and at some point you will say, I am afraid. And then you may even ask, and I talked about this in a previous video, you may even say, well, can I do it? No, don't ask that. Don't ask that. You want to say, is it possible? Ask yourself, is it possible? Because is it possible? The answer to that is yes. It won't be easy, but then again, if it were easy, everyone would go to medical school. It's lonely at the top for a reason. Everybody wants to get there. But many people are not willing to put in the hard work. Before you judge me on that statement, I also said very early on, and I truly believe this, it has been my experience, anybody who chooses to go to medical school and commits to it can go. Those who self-select out of going, it's often based upon fear. But back to that spring of your junior year, it's going to be difficult. You're going to be studying. You're going to be preparing for the MCATs. You'll have the naysayers, which we talked about, saying, "Oh, it's too much. You can't do it. I couldn't do it." Boom. They're not you. You've already accepted it. It's going to be a difficult period. I'm going to study for my classes. I'm going to study for the MCATs. When classes are over, I'm going to set up where I have a 2 or 3 week break where I can commit to studying for the MCATs. Then boom, we're going to take the MCATs. Now, a lot of that was preamble because I promise you, you're going to go through this emotional roller coaster. But if you know it's expected, if you know that's coming, it's easy to wade in the water. Again, MCAT is king. It's your GPA and your MCAT. Let me put it differently. You can have a moderate GPA and a super strong MCAT score and get in. You can have a high GPA and a low MCAT score and probably not get in. Well, you say it's not fair. No, it's not, but we also know life isn't fair. Follow me on this one. The MCAT just happens to be the gold standard. There is a correlation between MCAT score and how well someone will do their first year of medical school. And there's a definitive correlation between your MCAT score and your first USMLE, your first board exam. Your first board exam comes after your second year. And so medical schools, they are set up, they're conditioned, they're focused on making sure that their second year medical students can pass boards 1. And again, there's a correlation between MCAT scores and ability to pass boards 1. Just to take it a step further, there's a correlation between SATs and MCAT scores, which is a correlation to USMLE. But here's the beauty for those people who didn't do well on the SATs. By the time you're applying to medical school, no one's looking at your SATs. No one's looking at your high school's grades. Again, every 4 years is a chance for you to start over. So if your first set of 4 years you were great, you have an opportunity to be greater. Wherever you were, you have an opportunity to improve. If you can manage to get biochemistry in there before you take the MCAT, that's added benefit. It's been my experience that those people who get biochemistry, have that biochemistry course at least once prior to taking the MCAT, they improve their MCAT scores. Point of clarification, biochem is not required for medical school. It's not one of the 10 required courses for medical school. It's just added value if you can get a biochem course in there prior to taking the MCAT. No, I am not saying to delay taking the MCAT for the sole purpose of taking a biochem course. That is not what I'm saying. I'm saying something different. I'm saying for added value, if you can get a biochem course in there, boom, great. This is a video where there's a lot of content. Please go back, watch this video. Now I get it, the MCAT's here, and we've been talking about it. It's as serious as you think it is. Remember, we've already highlighted, you can't volunteer or extracurricular your way into medical school. You can't only GPA your way into medical school. By and large, the MCAT score plays a humongous role, and it is key. So if you're feeling a little bit nervous, good. Let that nervous energy turn into motivation. Because after all, we've been on this journey. We've prepared for this day. This is what we do. Leaders, dreamers, believers, we rise to the occasion. So take up your sword, take up your pen and pencil, study, and prepare, because that day is here. I'll see you on the other side.